a background for dermatology terminology, we were doing tabling, and we realized that not all people who are joining the event might be science background. So malignant refers to cells that grow uncontrolled and can spread to other tissues in the body. And they can also move through your lymph nodes. Sometimes they are cancerous. And then benign is a term used to describe cells that grow but do not spread to other tissues, which is non-cancerous. So they stay where they are. Lesions are an area of tissue that is abnormal or damaged. This can be due to injury, infection, and different disease. And then skin nodules are raised bumps on the skin caused by a variety of factors such as moles, skin tags, cysts, acne, inflammatory nodules caused by infections or allergies. And lymph vessels are a vessel that carries lymph, which is lymphatic fluid, and white blood cells through the lymphatic system. And metastasize are when the cancer spreads from one part of the body to another. So what are melanomas? As you can see, the top part of the figure shows normal moles that are non-cancerous or benign. And the bottom one shows a malignant form of the same, like the moles that have become cancerous or and so melanoma is a disease where malignant cancer cells are formed from melanocytes and spread to different parts of the body. Melanocytes refer to cells in our body that produce melanin, which is the pigment that gives skin the color it has.
Okay, so now it's my turn. Melanoma metastasization just refers to the step in which this cancer has spread from one place to another, and there's five different stages essentially when this would occur. So the first step is going to be the primary tumor formation, which is when abnormal growth of cells, melanocytes occur due to DNA damage, and tumors are then formed. Step two is a local invasion. So as the cells grow, as the tumor and cancerous cells start to go, they start to invade the surrounding areas, and they can penetrate through different layers of the skin and reach the lymph nodes. And from there, the cancerous cells can have two different pathways. One of them is that they can go into the lymphatic vessels and travel to lymph nodes. And the other one is that they can enter the bloodstream and the blood vessels, and they can go into different organs. This can be, for example, the lung, the liver, the brain, or the bones. Once these cancer cells have traveled to another area, to another organ, they start to develop secondary tumors, and they can impact the function of the surrounding area of that specific organ, and again, cause the formation and of cancer in another region that originally wasn't present in. There's different types of melanomas, but the four types that we're going to be talking about is superficial spreading melanoma. This is the most common type, and it makes up around 70% of all skin cancers. When it comes to this type of melanoma, it is usually flat and can be seen in different sizes and different colors. The second most common type of melanoma is a nodular melanoma, which is the most aggressive type because it looks like a regular mole and can go undetected for a long period of time. So by the time that it is detected, it has already metastasized, like we mentioned, and traveled to other organs and has affected other areas of the body. And it's usually seen as dark or red bumps on the skin. I am going to try my best to pronounce these. I did do the whole pronunciation YouTube videos of them, but I will probably pronounce them wrong, so sorry about that beforehand. But lentigo maligna melanoma, which is usually seen in the older populations, and it's usually flat and dark with uneven borders. And it usually occurs in areas such as the head and the neck and the hands, especially which are just areas that are in the sun for long periods of time. Then we have the acral lentiginous melanoma. And this is the most common type of, this is mostly seen in individuals of African, Asian, and Hispanic descent, and it's not related to sun exposure.
You did great for me.
Thank you. I Googled them because I was like, I can't pronounce it. When it comes to dissecting your moles and being able to see, maybe keeping a track on them to make sure they don't progress into anything serious, it is important to keep in mind the A, B, C, D, E's of melanoma. So the A just refers to symmetry. So moles that are melanoma or are cancerous are not usually even, so meaning that ones are not symmetrical, so one side doesn't match the other side. They also have very uneven, ragged, and blurred borders, which, while, regular healthy moles have very clean and round and oval ones. When it comes to moles that can be cancerous, their color isn't usually even. So they're not usually just all brown or all black or all pink. They have little spots of different colors in them. This could be like pink, red, black, and brown. There's also diameter. So moles that are usually melanoma are larger than 6 millimeters in diameter, and they're usually evolving. So if you see a mole that is constantly changing and looks different, the color looks different, the border looks different every other day, then maybe that is something that you should probably bring up to your doctor and get checked. It's important to keep in mind that these don't necessarily mean you're like, if you have moles that look like this, it doesn't necessarily mean that you have some kind of skin cancer. They're just important little factors to keep in mind. And go to your family physician or to a walk-in clinic just to get them checked out, make sure there's nothing serious. I'm gonna give this back to Tina.
So we just wanted to talk about the numbers a little bit because we think that melanomas are not as common, um, and we associate them with older age and such. But 9,700 Canadians were diagnosed with melanomas in 2023. 4,100 of them were women, and 5,600 were men. It could be because women use more sunscreen. And 1,250 Canadians died from melanoma.